Our state's coronavirus public health crisis continues to worsen. On July 16th, I stated that nearly half of our Tennessee counties were experiencing unacceptable rates of coronavirus transmission in our community. Today, all but 6 of our state's 95 counties are experiencing unacceptable rates of coronavirus transmission. The rate of less than 10 new cases per 100,000 persons per day over the course of 2 weeks has been recognized by infectious disease specialists as the appropriate level of community transmission we should use as a benchmark before we reopen our schools to in-person education. To be clear, to resume in-person classes safely, there should be less than 10 new cases per 100,000 persons per day for 2 weeks in a row. We need low incidence, and we need stability of that low incidence of infection. We need our testing positivity rate to be less than the 5% benchmark set by the World Health Organization. Currently, our positivity rate of our testing in Tennessee is approaching 10%, double that benchmark. This means we have excessive community spread of coronavirus in our state. I interpret these numbers to mean that we are seeing substantial, uncontrolled transmission of coronavirus in our community. With numbers like this, we have to first consider the CDC recommendation for reopening schools. The very first thing is that school administrators need to look to COVID-19 transmission rates in the community to guide decision making. Resuming in-person classes under the current conditions of out-of-control COVID-19 spread endangers our children, parents, teachers, bus drivers, families, grandparents. The list goes on. But honestly, all these numbers do not speak as loudly as the practical experience as one of our Tennessee school systems. Alcoa City Schools partially opened last week and sadly had a case of COVID pop up in their middle school about 2 days after opening. The bottom line, we must contain COVID. We must contain COVID first if we want to resume in-person education. I am Dr. Amy Gordon Bono. I am a primary care doctor in internal medicine, and I also hold a master's of public health.